I'm Ashlyn,
I'm Isabella.
and we did the zygapophyseal joint, which is a plain synovial joint, and it is located on the posterior side of your spine.
So, the zygapophyseal joint includes two muscle groups. The transversospinalis group, which this helps to stabilize the spine, and then the next one is the erector spinae group, and this one helps to extend the spine.
Okay, here are the bones. So basically, it's just the vertebrae of the spine. So specifically the superior and inferior articular processes. And basically the joint that we are focusing on, the zyga, it's basically right above the spinous process.
Okay, and then next is the ligaments. So there are, four main ligaments. So the ligament of flava, which are the elastic ligaments, and they're located on the laminae adjacent to the vertebrae. And then next are the interspinous ligaments, and these are between the spinous processes. And then third, the supraspinous ligaments, which connects the tips of the spinous processes. And then next, the longitudinal ligaments, which these go all along the back side of the vertebrae. And then they are on the posterior and anterior ligaments and reinforce the spine.
Okay, next we have the cartilage. So the main cartilage that is for the spine is the hyaline cartilage, which covers the articular facets, and it helps the spine withstand comprehension, which is called articular cartilage.
Okay, let's see. Next are the tendons. So this is pretty brief because the zygapophyseal joint actually doesn't really include any tendons surrounding it, although it does include nerves. However, yeah, it's mostly stabilized by ligaments, I suppose.
Okay, now we have joint disorders, and for the first one is just a disorder, and it is a facet joint cyst, which is a fluid sac that will be formed because of degeneration and instability in the spine, spinal facet joints, and then excess synovial fluid, which will lead to fluid-filled sacs. Treatments that can range from medications and physical therapy for less invasive cases, or you can do steroid injections and invasive procedures that include percutaneous aspiration, cyst ruptures, and surgeries. Oh, wait, no. Prevention. Take care of your spine and always have proper form. Have a healthy weight and stay active. Now, some causes or risk factors is age, trauma like a spinal fracture, genetics, or repetitive motion.
Okay, the next joint disorder is the capsular ligament strain. Oh man. Okay, treatments. Oh gosh. Okay, sorry. This disorder is a strain or tear of the ligaments that surround the joint, and treatments include ice, rest, compression, elevation, and physical therapy. In order to prevent this, you can stretch, do some strength training, and then causes and risk factors for this are trauma, increase in intensity when working out, and having poor technique when working out, and then surgery.
And these are our sources.
Thank you.
Thank you.